This is the case of Paige. Paige is a 12-year-old American Eskimo cross, female spayed. Paige has several splenic mass lesions seen on ultrasound and is currently demonstrating lethargy and vomiting. On physical exam, again, there were multiple large cavitary splenic mass lesions, one of which is seen on the image on the right side. No peritoneal fluid is seen. No evidence of lymphadenopathy was present. However, there were some vague, somewhat equivocal nodules seen within the liver, also on the ultrasound exam. We recommended thoracic films to rule out metastatic lung disease prior to possible splenectomy. This is a right lateral view of the thorax. Look closely for any pathology and, in particular, any evidence of nodular lung disease or evidence of lymphadenopathy. This is the left lateral view of the thorax. Again, look closely for any abnormalities. The VD view of the thorax. This is a close-up view of the cranial aspect of the thorax seen on the right lateral view. Note that there is a rounded soft tissue nodule that measured approximately 2 to 3 millimeters in diameter that is seen in the cranial ventral lung fields. Also note that this nodule cannot be definitively associated with any of the pulmonary vessels. Caudal to this region, there is also equivocal evidence of a moderately thick-walled pulmonary bulla. However, this bulla was not seen on any other view. However, neither was the soft tissue nodule. Our plan with Paige was to continue consideration for the splenectomy. However, the thoracic films show evidence of possible pathology, in particular the rounded soft tissue nodule. So we have two choices. We can either perform a spiral CT of the thorax, which should help better confirm or deny the possibility of nodular lung disease, or wait 2 to 3 weeks and re-radiograph the thorax to see if this nodule is still present, if the nodule has increased in size, or if more nodules are seen. Of course, if we wait 2 to 3 weeks, it delays the owner's decision, as well as worsens the prognosis, as well as risks rupture of the splenic mass lesion. In this case, a CT of the thorax was performed. This is a video clip showing the spiral CT of the thorax. Again, look closely for any evidence of pulmonary nodules. These are two static images at particular slice locations within the thorax. These two images are located rather cranially. On the image on the left, there is a very small soft tissue nodule seen within the cranial ventral right lung field. The image on the right side of the screen shows a very small discrete soft tissue nodule within the dorsalmost aspect of the left cranial lung lobe. These two slices are taken in the mid-lung to caudal lung lobe region. Note that the image on your left side shows evidence of 2 or 3 discrete soft tissue nodules, And the image on the right side shows evidence of 3 or 4 soft tissue nodules within the dorsalmost aspect of the right caudal lung lobe. These are pre- and post-contrast enhanced CT images of the cranial aspect of the liver seen on an abdominal window. Note that the contrast enhanced image on the right side shows contrast enhancement of the pulmonary vessels, as well as amorphous contrast enhancement in the left side of the liver that is not seen on the pre-contrast images. The cystic lesion seen within the right cranial abdomen in the area of the liver on both of these images represents a normal gallbladder. The other cyst-like lesions are cavitary lesions that are associated with the liver masses. So our diagnosis has now changed. Paige has multiple splenic masses, confirmed hepatic nodules, as well as confirmed but very small discrete soft tissue nodules within the lung fields. Neoplasia, particularly hemangiosarcoma, is considered very likely in this case, with metastasis to the liver and lungs. Is splenectomy warranted, or is biopsy even warranted? And the answer to both of these is probably not.